Hello friends, here I am trying to describe the layers which you will encounter while you dissect. When you put an incision, the first layer, as you all know, is going to be the skin. As you see in this layer, the layers of the lower limb or upper limb or any extremities, this is how you appear, how you approach dissection. Okay, now you can see the skin, the first layer of the skin. The moment you dissect the skin, the next layer is a superficial fascia. Then you have a deep fascia that is actually stalking, is like a stockings to the muscle, as you can see from inside. After the muscle you can see the bone. So this is a common, or by default this is what you see when you start your dissection. First, skin, superficial fascia, that is actually the connective tissue which contains fat, blood vessels, etc., nervous tissue, etc. Then comes the deep fascia, which is stalking the muscle layer, and finally you will come to the bone. Okay, now let's see how it is different from the layers as you see in the scalp. Okay, same thing. Okay, this is a picture of a scalp, a coronal, sagittal section of the scalp, where you divide the head into right and left half, and you can see the skin here, just like you see the skin in the upper limb. Then comes the superficial fascia, that is what we call here as a subcutaneous tissue. Then you expect the deep fascia. Okay, let's see what happens here. Here we can see in the deep fascia is called as epicranial aponeurosis. It is technically the deep fascia, but if you go forwards along the epicranial aponeurosis, you can see the frontal belly of occipitofrontalis. You can see a muscle which is getting inserted to this deep fascia, like this occipital part. And if you go for the frontal part, and if you go backwards, you can see the occipital part. So along with the deep fascia, you can see the muscle layer. So that is the difference between the limbs and the scalp. So when you go further deep, you have a loose areolar connective tissue. Then comes the bone. Okay, so we can call it by the name scalp, that is skin, connective tissue, the epicranial aponeurosis, loose areolar tissue, and the bone. So that is the difference between the scalp and the extremities. Now let us see how the layers are arranged in the anterior abdominal wall. Again, you start with the skin. So if you imagine you are dissecting in, you are putting an incision. So first incision which you put is the skin. Then comes your superficial fascia. Here we can call it as a fatty layer. Then you have the fascia called the membranous layer. So both of this comes under the superficial fascia. After the membranous layer, you have the muscles. Okay, 1, 2, 3 muscles: external, internal, and transverse abdominis muscle. And you can make out there are layers of deep fascias covering these muscles, but we never call it the deep fascia in the anterior abdominal wall. Instead, they can be said as the connective tissue covering the muscle. Now, deep to that, we can see the fascia transversalis, and further deep to that there is something called the extra peritoneal tissue. Then comes the parietal layer of peritoneum, which is covering the peritoneum, that is the peritoneum of the internal viscera. So these are the layers which you encounter while you dissect the extremities, the scalp, and the anterior abdominal wall. Thank you.